Infecting someone intentionally with a virus and using a condom, of the two, what is a sin and which is a crime?
Fred. Yes. Who is HIV positive among you?
The Ministry of Health, in collaboration with Abbott and Life Care, has today, 2nd March 2023, launched the integration of HIV self-testing campaign among the youths.
Today we are here to launch the Check Now HIV self-test kit that has been demonstrated to offer high-quality results here in Uganda. The kit has been evaluated at the Uganda Virus Research Institute and found to be of high quality. This kit will be an additional tool in our arsenal for HIV testing, which is the key entry point for HIV prevention and control interventions. This enhanced capacity for testing will boost the HIV programming and push us further towards achieving the first 95 goal.
The Minister of Health, Dr. Jane Ruth Acheng, further called upon all Ugandans to participate in the fight against HIV/AIDS.
Today, we add yet another important collaboration with Abbott to support the drive towards ending AIDS as a public health challenge in Uganda by 2030. And I do hope all of you are prepared to ensure that we end AIDS by 2030. His Excellency the President,
Charles Njuguna, on behalf of the World Health Organization, emphasized all people to keep themselves safe and also protect others.
And especially among the youth, very, very critical, because this is a very active population. You need to be responsible enough to ensure that you protect yourself, but also protect others. Let's also not forget about some of the key messages, like emphasizing the need for abstinence. I know.
While explaining the Triple 95 target, Dr. Mwebesa noted that the campaign is to sort the first 95%, which deals with knowing your status.
At least 95% of the HIV patients have been tested and are know their HIV status. Of those, 95% have started on treatment, and of those started on treatment, 95% have their viral load suppressed. So when you hear us talking about 95, 95, that's what exactly we are talking about. The campaign is using a kit called Check Now, it's very well shown there, which was developed by Abbott, mainly to extend HIV testing services. And this will further promote linkage to care and to prevention services. Because once you test, then you have to be linked to treatment. And also, once you test, it will also promote preventive services. Because if I test,
on the distribution point of view, according to the Vice President Abbott, the government is taking a lead so far as of the distribution plan.
The government will be responsible for the distribution plan with our partner here in the country. There is different location it's going to be within the country. Now we have 16 and it's going to be increased. And also for the private market, there is a PanBio self-test for the private market, like Check Now. Check Now, it's distributed by the government. PanBio self-test, it is for the private.
Students leaders who have been part of the campaign appreciated the ministry and encouraged their fellow to embrace the initiative.
As a leader of Indeji who took part in this, I appreciate the initiative of introducing this HIV self-test, because as we, like the youths, it's always difficult for us to go to clinics, to hospitals, so it's really a good idea.
We are happy that we have been part of the launch of the Check Now HIV tests that was sponsored by the Ministry of Health with associationship with Abbott. I would like to encourage all students, mainly students from different universities, to be part of this campaign. Get to know your statuses.
Other students, in addition, explained the advantage of the self-testing being confidential.
initiative, because for me as a lab technologist, I found that it is hard for people to go to the hospital and access these kits or be tested from the hospital. Reason being, there are a lot of stereotypes. They fear the issue of stigmatization. They fear that people will know about their results and they will be isolated in the community. But when we get to interact with these people about the issue of self-testing, it becomes something very simple for people, because as we took back this test kit to the university, there was a lot of demand. People were demanding, even up to now, people are still calling and they're asking us to give them more kits. And we are calling upon the Life Care Diagnostics to keep on adding this, and we want to appreciate Ministry of Health in conjunction with the World Health Organization for bringing this initiative, because it's going to help university students basically to know their status, and they will have a safer life in future.
The leaders to go to our colleagues, and they call us peers. By that they mean us who are going to interact with our fellow colleagues in the various universities. We go back to our friends to teach them how to use these kits, to teach them the awareness about HIV. We all know that HIV has been something that has been facing our country for quite a number of years. And
in attendance were, among others, the Ambassador of United States to Uganda. Universities include Ndege University, Nkumba University, Makerere University, Uganda Christian University, Uganda Matters University Nkozi, Kyambogo University, among others. Sala Chirabo, live at 8.
This is Ndege University. Kindly hold your certificates up as we're flagging this up.